Hello, hello. The time is noon. Wait a little bit. When you pop on, say hello. Okay. Just waiting for folks to join before we get started. So definitely put questions in the comments, even if you are joining this later. Be happy to look back at those and do any follow-up questions that you had. Today we are covering what is a DO and what in the world is that OMT stuff. So hopefully this will just clarify some common questions that folks have and just give a little bit of a background on what it is to be a DO, which is what I am. That's the type of physician I am. And then what is the OMT, the osteopathic manipulative treatment or therapy. Some people might use that for the T, and some people even call it OMM, osteopathic manipulative medicine. So what that entails and how we might use it as a part of a treatment plan. So we shouldn't be too long. I did like some slides, so I only have 6 slides. So it shouldn't take us that long to get through it. So definitely, if you're having questions as we go along, just let me know. We'll give just a couple more minutes. I know I'm like antsy and raring to go. Oh, hi, Becky. I see you there. Good to have you. But we'll wait just a little bit, let some other folks maybe jump on. How's the weather there, Becky? Are you getting sunshine or clouds? Couple more comments for people. All right. We'll get going here soon. A hot one, hoping rain. Oh, yeah, definitely want the rain to knock the smoke out of the air when there's those fires going on. That's one thing I'm glad this year we did not have to deal with, all that smoke from Canada that we had last year. I was like, oh yeah, I remember this from living in South Dakota and all the California fires. Okay. Hi, Nikki. Good to see you here. How's your Monday, Tuesday going? I never seem to know what day it is. And then when we have a holiday, I'm really off kilter. All right, so we will go ahead and get started. Yeah, I feel that. So today we are, for those that are just joining in, we're going over what is a DO and what is OMT or OMM, some people call it. So that osteopathic treatment stuff that we do that people are like, well, it's kind of like this, it's kind of like that. I don't know. You just have to be there to understand it. So hopefully it will answer some common questions, maybe clear up some common misconceptions as we go through. Hey, Mo. It's good to see you. My goodness, joining from afar. All right, so a doctor of osteopathy, a DO, oftentimes they're called an osteopathic physician versus an allopathic physician, which is like your MD. So we both go to medical school, osteopathic physicians and allopathic or MD physicians. We all have the same like chemistry, biology, anatomy, physiology, all those types of classes. We have the same. Where I went to school at Michigan State at that time, in our first and second year med schools, we actually had our classes together. DOs just also get additional training, of course, for doing the manual manipulations, that manual medicine, or the osteopathic treatments. So when my med school had kind of this slogan for the philosophy of osteopathic medicine, and I really love it. It's the science of medicine, the art of healing, and the power of touch. And I really believe all those things work together well to provide excellent care for patients, right? So it's that balancing act of science, what it is to be a healer, that art of learning to work with people, meeting them where they're at. And then with the osteopathic side, that power of touch. And I tell you, it makes a difference, right? We are human beings. And even if you're not a touchy-feely person, having touch can be a powerful component for a treatment plan and getting you better. So we do have a holistic approach, so a whole person approach to care, and throughout the training that was emphasized, that we want to think about the person as a whole, what other factors in their life could be contributing to what is going on with their medical conditions. So whether that's family medical history, lifestyle, just things that are going on in their life that could be causing stress or disruption to their schedule, all of those things. And a lot of allopathic physicians do the same, right? Like this is not something that is just solely an osteopath alone, but it's definitely something that was emphasized in a part of the philosophy in our education and training. So really just looking at that overall. And osteopaths do kind of talk about and emphasize, especially in our osteopathic classes, that the body has that power to heal itself, right? If we can kind of get some function restored, there's ability to heal itself. Osteopaths are fully licensed medical doctors, physicians, right? So we can specialize just like an MD can. We could specialize in any field of medicine, whether it's surgery or medicine specialties, any of those things. We can prescribe medications, order testing, labs, radiology, just like MDs can. I don't think people really have that misconception as much anymore, but like back in the day, they used to, maybe not be able to, way back in the day, DOs when they were first getting started. And so a lot of people thought that kind of carried over, but doesn't. We can do everything a doctor can because we're docs. So a DO a lot of times gets mixed up with maybe some other things. So a lot of times people will say, well, is a DO a naturopath? So we do have a lot of the same philosophies and kind of foundational thoughts that a naturopath has, whole person approach, lifestyle, those sorts of things. But, in my medical school training as a DO, I did not get trained on like herbal medications, doing detox or homeopathic treatments. So that was not something that I had education and training in as a DO at my school. And I can't think of any DO schools that do. There might be some that are doing that, but none that I know of. Another one is a functional medicine doctor. So functional medicine doctors are oftentimes physicians. They have gone and done these additional training. There are some like nurse practitioners that will also do some functional medicine training and certifications, but they again have additional training, learning some of these more in-depth tests. They get into genetics or in-depth hormone testing, and those are not typically what a person who's going through medical school, traditional residency, is going to be trained in. So those are additional things that they have to get learned about before they practice that. A chiropractor is a DO chiropractor. So again, a lot of similarities, right? We do manipulations. We kind of believe in structure, function, really impacting health, but they're not physicians, so there's things that they can't do. They can't prescribe medications. They oftentimes do radiology testing, x-rays as a part of their workup, but any further testing, they have to refer back to primary care or a specialist to do that. So principles of osteopathy. So I'm just going to kind of read through these. So the body is a unit, right? All of us together. It's a whole unit. It all interacts and interplays with each other. So each organ interplays with each other. Each bone joint, knee bone's connected to the hip bone, that sort of thing. Structure and function go hand in hand. So how things are put together affects how it functions. The body possesses self-regulatory mechanisms, and the body has an inherent capacity to defend and repair itself, right? So we have those white blood cells put in to fight off infection. We can heal a cut, those sorts of things. Can't regrow a limb. We're not that cool, but we can definitely repair some things. So when the normal adaptability is disrupted, or when there's environmental changes that overcome the body's capacity for self-maintenance, disease will likely occur. And there's kind of a balance in this, right? So everybody's genetic makeup is a little bit different. So, what might cause disease in me by the time I reach 45 might not cause disease in someone else until they reach 85, or never, it just depends. So there's that balance of, genetics play a role, but we all need to make sure that we are doing those lifestyle things to help our health as well. And then rational treatment is based on these principles. So we're kind of using these to guide, is this a good treatment? Is this going to be helpful, beneficial, harmful, that sort of thing. So what the heck is OMT, or OMM as some people call it? So again, I kind of mentioned before, it's a manual therapy, right? So we're using hands to do a treatment on a body to assess if there is dysfunction, where that dysfunction is, the interconnectedness of the dysfunction. So a lot of times as I'm treating patients, they're like, I didn't even know I had a pain there. And I'm like, well, it was connected. We found it. It involves various techniques that are gentle pressure. You might do some body positioning, have some patient resistance, right? So put you in a position and ask you to kind of push or resist a little bit back. We're focusing treatment on ligaments and tendons, the muscles, the lymphatics, the nervous system, and the bones. But we're using a lot of soft tissue techniques. There are high velocity or cracking techniques that we are trained on as a part of our, curriculum in medical school. But I will say, that most DOs, as they go through whole life experience, and we end up, hopefully things are okay. It looks like there was, okay. So anyway, I think it's connected now. Okay. So hopefully things are still going. So the cracking or the high velocity techniques, a lot of DOs, will use them less and less. There are some DOs that use it quite a lot. And that just, again, is experience, which is the great thing, because there's different tools in our tool bag to be able to identify what we feel is going to work best for that patient. Osteopathic. Oh, thanks, Nikki, for letting me know that you could see me. I wasn't sure if maybe my provider service, took over for the internet when it was failing there. So hopefully that's the case. But OMT is a component, right? So we use it in combination with exercise, with medications, with physical therapy, potentially surgery. I mean, if there's something there that's really broken, it's going to need a surgeon to put it back together again. Treatments can either be long-term or short-term. So I have some patients who may come in, for a few months, and we do some treatments regularly, and then they're okay for a while. We kind of fix that problem and they're good to go. And then there's other people who have more chronic things that just need a maintenance program. And so we're going to do that more long-term on a scheduled basis for them. So what OMT is not, it's not an expensive massage. There can be some things that feel a bit massagey, but it's not massage. It's not chiropractic care, even though, again, there are some similarities with that. Some people will say it's voodoo or magic. Granted, I know it can feel that way, but trust me, we're actually doing some concrete physical things. We're actually changing some things. And it's not a replacement for physical therapy, doing a home exercise program, right? We talked about it's a component of that. It's a part of that. It works together. So I will often tell patients, when you come in, I find what's there and I fix it, right? I fix what's here, but I can't, because I don't live with you every day, I can't do anything to keep it from coming back. So that's your side of the deal as the patient. So whether it's assessing your workstation, your ergonomics, even your car, that's a huge one that a lot of people don't think about, their positioning in their car, especially if you drive a lot. Exercise, stretching, strengthening, those sorts of things. Those work hand in hand with the treatments that I do to kind of help things either from coming back or from getting as bad, right? So it can have benefit to your treatment so that it's lasting longer, you're getting a better response. So we got to do all the things. It's also not an easy fix to a chronic problem. So I know some people will be like, I've tried everything else and here I am. And they maybe hope that, we can resolve things in 4 treatments or something like that. But usually by the time we get to 4 treatments, that's when I'm like, we should be getting some traction now. We should start feeling like things are improving, especially if this has been a long-standing issue, because if it's been there a long time, it's going to take a long time for it to get worked out and then to get to a point where we're maintaining it well. But typically I tell people, after a couple treatments, you should really feel like you're having some improvement that's hopefully lasting throughout the day into the next day, maybe even for a few days up to a week. And then as we get past, treatment number 4, then, like I said, we're gaining traction. So things are kind of sticking. You're starting to notice some longer term benefit. You feel like things are moving better. And then it's just kind of determining how often we're needing to treat you at that time, whether we're going to be on, a maintenance program, whether we think we could do a few more treatments and get things resolved. Any questions so far? I've been seeing some thumbs up, so hopefully it's been making sense and clicking together. But that's kind of DOs and OMT in a nutshell. I use OMT to treat a lot of different things. Yes, Nikki's had some treatments. Yeah, and definitely people do feel better. I mean, most people, they get up off the table and they have improvement right away, which is nice. So then it's just a matter of how it sticks. But I've used OMT, obviously to treat a lot of spine. That's kind of the most common. Low back, upper back between the shoulder blades, neck pain. But I've definitely had people with some limb pain, joint pain, leg pain. Have had patients with problems with lymphedema or swelling, whether that's after blood clots. They've had lymph nodes removed, due to breast cancer surgeries. We've gotten some good relief there. I also treat a lot of headaches or TMJ. Those are another common area that I do treatment for. And then other things that people maybe wouldn't think about that I can treat are things like acid reflux. Also, if people have heart failure, we can do some things to kind of help with moving fluid around if they're having some swelling because of that. And then even breathing issues like COPD, there are some treatments that we can do to help open up that. So there's a lot of different things, you know, that we can address with OMT. The other one that's pelvic pain in females, that's another one that I oftentimes will treat and get some really good relief with that. So yeah, Marty, give me a call, or, you know, the links for the booking site are on the Facebook page. So you can always use those if that's easier for you to be able to go online and look up a time slot to get in. So with Crossroads Family Medicine, you know, you don't have to have a primary care membership. So if the membership just isn't something that is for you, you don't have to have that to be able to come and see me for OMT. We can do that just as a pay-as-you-go. So that's an option. Members definitely, you know, can get a treatment. But if you are like, nope, you know, the monthly membership isn't for me, I don't need the primary care services, we can always just do OMT as a pay-as-you-go. So reach out with any questions that you have about that. You know, feel free to give the clinic number a call if you wanted to chat with me about it. That's always an option. And yeah, if you think of questions later, feel free to pop on to the video and just leave it in the chat. You can also send a direct message, but just no patient information on there. We want to keep things private and secure. So if you have questions that might have some sensitive information, make sure that you're calling me to ask those questions. Okay, all right. Well, I hope you guys have a great rest of your day. Thanks for jumping on, and I wish you all well.